He couldn't believe it. He thought it was a miracle. He had no explanation for it, and he was just amazed. My last appointment with my oncologist was approximately 10 years ago.
The gentleman that had the testicular cancer was actually a doctor himself. I was amazed how easy it was to get patients to come forward. I did not pay them to speak. As they left the Gerson Institute, I noticed a framed letter on the wall. A closer look revealed it was from Prince Charles' office. Prince Charles has demonstrated a profound interest in Gerson's work after seeing a patient with terminal cancer that was sent home to die recover.
Doctors often bring up the argument against the Gerson therapy that it is an unproven cancer treatment. And my question is, what does unproven mean? You see, you cannot prove this therapy the same way as you prove a new drug. What I have in mind is the double-blind randomized clinical trial, which is great if you want to test one new drug. How do you apply this to a therapy that is a total lifestyle?
Charlotte Gerson had 2 children, Howard, whom I met earlier, and Peggy, who lives in Italy with her husband and daughter, Etta.
Dr. Gerson's therapy was and is in complete unity with sustaining the environment. They're intertwined. Dr. Gerson observed and proved that the natural world is our external metabolism.
I cannot understand why my great-grandfather's gift is kept from suffering people on purpose.
In Holland, I learned of a doctor who had been treating his patients with Gerson successfully for over 16 years. I met with him and his wife at the local organic food store, where we became acquainted. As we walked along, he invited me to meet the rest of his family. His name is Dr. Wilco van der Vecht, and I was quite impressed that his young son and 15-year-old daughter already understood and enjoyed a lifestyle that will profoundly affect the rest of their lives. Undoubtedly, they had witnessed at a young age the healing of their father's patients. I had never seen a young child look forward to and register such enjoyment in a glass of fresh-pressed carrot and apple juice like Wilco's son.
Ik denk dat Danny heel veel dorst heeft. Ik krijg nog wat nieuwe. Oh, hey Dan, heb je zo'n honger? Is lekker, jongen?
Dr. van der Vecht brought me to his office, where he pulled out drawer after drawer of detailed files of patients treated with the Gerson therapy successfully. But why is this doctor implementing this therapy to his patients? Part of the reason is that his uncle in Switzerland suffered from cancer and had a tumor on his right shoulder that literally rotted away on the therapy.
I would say 75% of my patients would react on the Gerson therapy favorably.
Within minutes of my request to meet a patient of Wilco's, a lady arrived that recovered from a number of ailments.
Ik weet zeker dat de Gerson-therapie mij...
She described a recovery that stunned her regular doctor, and he could not understand how this amazing transformation had taken place, and could only surmise that it must have been the prednisone he prescribed once.
Treating cancer patients with alternative therapies is very difficult, and a few doctors have had process from the authorities, and it's very difficult to treat them with alternative medicine. It's like a kind of quackery to treat these patients.
Why is it so forbidden, you think?
Well, they fear that many people want to do or want to have treatments on a natural way. And I think there's a lot of pressure from the pharmaceutical industries, and they treat all the patients with chemotherapy and radiation. And when they see that food plays an important role in the treatment of cancer, they fear they will lose control of the popularity of the people. In Spain, I got 4 or 5 colleagues could join me in the clinic to help me to do the therapy, and we have nothing to fear in Spain.
Amidst 2,000-year-old Roman ruins high on a bluff just outside the village of Ronda on the southern tip of Spain, Wilco pointed out to me in the undulating valley below his new Gerson clinic now being prepared to open within the next year. Dr. Vandervex drove me to this facility before renovations begin. His current caretaker, who previously owned the property, took me on a tour of the grounds.
Well, I am now from here, I should say about 60, 70 kilometers to Marbella. Oh, the land is quite fertile. I mean, the land is not wood, you know, it's not forest.
Perhaps someday, somebody I know may come here to reclaim their life. When I landed back in the United States, I looked off in the distance at an icon that gave me hope. And on this wintry New York day, I had a chance to visit two special landmarks. En route to those locations, I was able to experience what the locals busy themselves with each day. And it was also memorable to discuss how these folks view someone with a camera trying to make a documentary. The first landmark I found was Sloan Kettering Hospital. This section of the hospital was new, but on the back side was the older part of the building, built when Dr. Gerson lived in New York. Nobody at Sloan Kettering would talk with me, and for good reason, I suppose. The founder of it was Dr. Cornelius P. Rhodes, a physician who despised everything Dr. Gerson stood for and called Gerson, quote, a notable quack. As someone said to me, more people make a living off cancer than die from it. Then I found the second landmark on Park Avenue. At 815 Park Avenue, I met up with Dr. Carolyn Dean, a medical doctor.
This is where Dr. Gerson was up until the day of his death, where he had a clinic, where he saw patients, where patients recovered from cancer, where he documented so many recoveries, yet those recoveries are not available to the public. Those published articles have been published in Europe, but have not been allowed to be published in American journals.
Why?
The reason for that is the fact that it's not a patented medicine, and it's not an expensive medicine. I mean, this is the crux of the matter. This is a natural therapy that allows people to take control of their own health and not require drug interventions, and therefore it doesn't fit into the medical scientific model of American medicine.
Dr. Dean is a health activist that gave me a new perspective.
C.P. Rhodes founded Sloan Kettering, and he did it on the scientific model. He wanted to make cancer research very scientific. However, the scientific model only tests for one variable at a time. Gerson therapy uses hundreds of variables. Therefore, science is not equipped to test the Gerson therapy.
How many people are dying in the hospitals every year because of hospitals like this?
In a paper I wrote called Death by Medicine, that then I expanded into Death by Modern Medicine, I found that 784,000 people are dying annually prematurely due to modern medicine. And these are statistics from peer-reviewed journals and government databases. I see the Gerson therapy as the antidote to our chemically damaged bodies and environment.
And then I met Dr. Stephen Barrett, who is highly regarded by the medical establishment as an authority on health fraud.
I don't believe there's any evidence that any diet will affect the course of any cancer. Take the Gerson therapy, for example. Gerson was a physician who claimed that he could cure cancer with diet and a number of other methods. There's absolutely no scientific evidence that he's cured anyone.
Dr. Barrett is also an author, and his work is widely distributed to colleges and universities.
There are testimonials. There are some people who've been tricked into thinking that it worked for them, but some of them may not have had cancer. Some of them were not adequately studied. The Gerson Clinic has not had any systematic follow-up. It's all smoke and mirrors. The Gerson therapy is not a large part of the marketplace anymore. There are actually hundreds of places that offer treatment. Gerson is of historical interest because he was one of the big names in cancer quackery. We collect information from the internet, from clinic literature, from patients. We get patient stories. We see what the proponents of the various methods write. We look at the claims. We try to see if they make sense. We get all sorts of information and try to put it together.
Have you ever interviewed any of Dr. Gerson, the Gerson therapy patients that claim they've been